we will kick this off at 11:15 and get you guys some great information on stem cell recruitment therapy, which is pretty amazing stuff. So I'm excited for this. So we'll have little bit of time. I'll open up the webinar for questions at the very end. So for those of you who are familiar with webinars, which our world is becoming more and more familiar with them as of the last year or so, there is a chat feature on Zoom, and you can select that, and you can message me or the group directly with any specific questions. And as I see them, I will answer them. Otherwise, we can definitely wait till the end, and I can unmute everybody, and then you can ask me questions directly. So I'll definitely plan to stick around and answer those questions. So if you've got one, write it down, then we'll make sure that we address it from at the end. So. All right, so we are at 11:15, so let's go ahead and get going. So this is the webinar on stem cell recruitment therapy, which is recently changed to being covered by Medicare, which is pretty amazing stuff. My name is Dr. Chris Cox. I'm a chiropractor here at Life Aligned Wellness Center. And my purpose today is really just very straightforward to bring you education. So this is a topic that there's a lot of confusion around, a lot of gray area. I have been working in the field of natural health and well-being for almost 25 years now. And I'd like to share some of my experiences and some of the things I've learned, and specifically working with stem cell therapy and amniotic therapy and stuff like that for the last 3 years. Really been studying it very in-depthly. So my purpose here today is just to provide education and provide answers, and hopefully some insight into what stem cell recruitment therapy is and kind of how it works, and a little bit of the ins and outs, and hopefully clarify some of the confusion that's out there, and maybe see if there's if this particular therapy might be a good choice for you. So let's go ahead and get rolling. And so again, this is really a revolutionary procedure, really designed to prevent surgeries and prevent the use of medications. It literally is a way that we might be able to actually help you end your pain. You know, having worked with people now, specifically with this particular therapy for about 4 months now, we've been doing surveys for people that have who have already received the treatment, and literally within a week, people are telling us they're seeing with between a 30 and 80% reduction in their symptoms. And a lot of times people have had these symptoms for, you know, a decade or two. So pretty miraculous to see some of those changes so quickly. Why is it revolutionary? Well, it really can prevent surgeries and prevent the use of medications, which is something that is really new to this particular field. And we'll talk more about that in a couple minutes. So it's exciting today. For me, it's exciting because I already know what's possible. Having worked with hundreds of patients over the last few years, specifically with this type of therapy, I know what's on the other side. So I already know what the results are like for people. So it's really, really cool. And when people finally have the chance to potentially feel better and end this kind of never-ending cycle that seems to be on a, you know, downtrending, and people really get their life back. You know, people that are able to get out and play golf and swing the golf clubs and carry their grandkids and, you know, take walks and that type of stuff that they kind of have given up because of the pain. It's really exciting to see that this is potentially a possibility that could really change someone's life and really give that quality of life back. So it's an exciting day. So one of the first things I want to kind of dive into here is kind of an old way of thinking versus kind of a new way of thinking about this. Regenerative medicine is a relatively new kind of subset of medicine, and it really is a different way of thinking. You know, standard medical procedures, you know, which are commonly drugs and surgery, right? They tend to treat, or they aim to treat your symptoms, right? If you've got a particular degeneration type thing, well, it's like, okay, here's an anti-inflammatory, or here's a painkiller, or here's a surgery. And these are what's called degenerative therapies, right? So there's There's nothing about them that's regenerative in nature. And regenerative medicine is all about actually returning the body back to its more normal state. So in essence, it's almost like kind of turning the clock back. So stem cell recruitment therapy is a regenerative therapy. It's not a degenerative therapy. It's literally reversing the clock is what regenerative therapies are. So important distinction when we're evaluating kind of what we're doing here. It's very different. We're not treating the pain, we're focusing on regenerating the body. So, and it's not just a simple, oh, you're just getting older, right? These conditions actually can affect people of every age. We've seen people do amazing in their 20s and 30s that already have degenerative type things or chronic inflammatory issues in their joints. Arthritis is not just a product of time. Having worked in the healthcare world for 25 years, we see regularly, we see arthritis or the beginning stages of that, people in their 20s. So it's not something that's just, oh, I'm just getting older. It's common as people get older, but it's not just about a particular age range. And it's very common that your condition is robbing your quality of life and keeping you in pain, right? So that's by having this degenerative change, it's in most cases affecting a person's quality of life. And our purpose here today is not just lecture, but to be able to interact and educate and really raise our awareness of what's possible and how best to kind of generate the outcome that we're looking for. I had a mentor 25 years ago tell me one of a thing that's really stuck with me is in life there really are no guarantees. There just isn't. It's that simple. And what he did say though is that you can guarantee one thing, is that if you don't take the actions necessary to produce the outcome that you want, we can pretty much guarantee that it's not going to happen, right? So what we want to do is try and figure out how do we increase the probability that we're going to get the outcome that we want. And for most people, that's a return to a higher quality of life. And that's part of what today's kind of information webinar is about. So next thing that we want to kind of orient ourselves is really how we're thinking about this particular thing. So the question, that I've asked over time is, how do we take care of our car, right? When the warning light comes on in our car, how quickly are we to get it checked out, right? Well, for most people, if not that day, within a couple days, right? So it's like the warning comes in, we know our car is going to, something's wrong and it's going to become unreliable, not perform the way we want it to perform. We have to really examine this in terms of the symptoms of our body, right? So symptoms are literally a warning sign that something's wrong. So we know that we check our car within a day or two if we had a symptom, but if we've got a symptom in our body, sometimes we'll ignore it or suppress it for decades, right? So, I kind of make the joke, when the service engine soon light comes on, do we put a piece of, electrical tape over it, just not look at it, or, do we take our car in and have it serviced and figure out what's going on? Same idea. I think our body deserves the same thing. We only have one body. So it's important that we take care of it, because as I think most of us have figured out, is that, once we've lost our health, we've really lost everything. Nothing else really matters as much if we don't have the quality of life we're looking for. So it's really examining, making sure we're keeping our body as a high priority relative to our health and our quality of life. So really, what are the options, out there when we're talking about degenerative arthritis and stuff like that? Well, one thing, obviously, is we could just do nothing, do nothing different, right? And that's kind of the whole definition of insanity, right? It's the whole, doing the same thing over and over again, expecting a different result. So if we continue to suffer with the pain, the limitations, the loss of function, not only do things not change, they actually continue to get worse. So doing nothing is an option, right? And there are outcomes specifically for that. Another option that is out there, obviously, is taking more medication, right? So things like cortisone, which is a type of steroids, and other pain-reducing drugs provide temporary pain relief without really addressing the cause, right? For example, is the reason, that we we have a degenerative joint? Is it because we're, our blood cortisone levels are low? Like, well, no, that joint degenerated because it's not functioning properly, right? And the cortisone, not only does it just reduce the inflammation, it actually wears away the joint a little faster. So it's not actually fixing the issue. It's hopefully just giving some temporary relief. So one of the things that we like to differentiate is the difference between management and resolution. And we can manage symptoms lots of different ways. And with stretching and exercise and nutrition and all that kind of stuff. But there comes a point where managing is just trying to keep things at bay. Resolution is trying to look at how do we fix the foundation, so to speak. And that's part of what regenerative medicine is more about. Surgery, obviously, is another option. And obviously, it's painful, it's expensive, it can result in the need for additional surgery. So very, very common effects. And again, the reality is that if we think that we continue to use the old kind of medical methods, that our health is actually going to become better as a result of that, well, that's not how it works, right? The old methods are degenerative in nature; they're not regenerative in nature. So again, regenerative medicine focuses on your body's natural healing abilities and getting your body to actually regenerate itself. So it's a very different thing. It's a very different way to think about health and well-being. All right, let's keep rolling here. So for many of you, you may already know the cost of surgery, right? There's obviously a lot of pain that's associated with surgery. There's extended recovery time. We don't have any guarantee of result. The high percentage of failure and complications. The average cost for an uncomplicated case statistically is about $55,000, and a lot of that comes out of our deductibles. And then, factoring the cost of our lost time and function and pain and suffering and all that kind of stuff. So you can see kind of the couple of journals where we pulled this information from, that's just the reality of surgery. And for some people, it is the only option. But for a lot of people, there's a more natural way to actually do this and regenerate the joint rather than replace it. Things like spinal surgery, right? So the procedure has a price tag averaging around $80,000 and has a success rate of about 33%. Now, these are most likely benefits are the young, trim, and athletic, not the typical surgery candidates whose average age was 54. So the 33% success rate has to do with the younger candidates, not when people are older and have in most cases, more degenerative change than people who are younger. So we have to be aware that number one, the cost that goes along with it, but also the success rate is pretty poor. So by utilizing regenerative type medicine, we actually get to a point where we can regenerate the body and help that joint actually function more normally again. Oh, really cool stuff. So painkillers are dangerous, right? So non-steroidal anti-inflammatory drugs, right, NSAIDs, are literally an epidemic. This is from the FDA a few years ago. The risk of heart attack or stroke can occur as early as the first few weeks of using an NSAID. The risk may increase with longer use of the NSAID. So I think we've lost a little bit of, so again, I'm kind of putting my clinical hat on with this. I think we've lost the sensitivity to NSAIDs because they're becoming so popular, right? They're just, oh, well, I just take Advil, or I just take ibuprofen, I just take, whatever it might be. And the risk is significant. So it's one of those things that I think is kind of swept under the rug that maybe this isn't the best idea. There is a cost when we're taking NSAIDs. And obviously the FDA has commented on that as well. What about things like cortisone injections? So I hear a lot of people use these. I know a lot of our patients have used them in the past, and mainly because it's a very, very powerful anti-inflammatory. I mean, there's no denying that whatsoever. However, what's often not discussed is the other side of the coin, right? It actually increases an 8% more loss of bone within 4 months after the injection, right? It accelerates the breakdown of the joint. You're limited to 2 injections a year because of that, among other effects on kidneys and liver and stuff like that. Low doses for 1 year can cause cataracts, right? And then the suppressed ability to fight infection. So all of these things are effects of cortisone. So yes, it's a very powerful anti-inflammatory. It can sometimes help manage the pain in a joint, but there's a lot of other degenerative effects that go along with it. And that's kind of what we talked about initially. There's a difference between degenerative medicine and regenerative medicine, two very different things. So this next graphic just kind of talks a little bit about the stem cell recruitment therapy and this particular therapy that we're utilizing that is covered by Medicare for patients who qualify, which there's information we'll get to a little bit about that, is what's called amniotic therapy. And a real general overview of stem cell recruitment therapy is your body has the ability to regenerate itself. It always has. And it requires certain signaling for that to actually happen. And as we age, that signaling that occurs naturally when we're really younger gets less plentiful as we get older. So the regenerative signaling decreases. And what, in essence, stem cell recruitment therapy does is it replenishes that signaling effect. So think of it like a car that is driving and then runs out of gas. When the car runs out of gas, what you don't do is replace the engine, right? You don't paint the car, right? You get some gas and you put it in the tank and you refill the gas tank and then you turn the keys and you start the car and you drive off again. And that's in essence what stem cell recruitment therapy is about. Is it's replenishing the fertilizer or this healing gas tank or the matrix that's necessary for your body to regenerate itself. So this particular treatment actually uses amniotic fluid from full-term healthy mother, healthy baby, live births, cesarean section. The amniotic fluid is saved, and then it's processed in a way that makes it completely safe. And is what's called an acellular therapy, and that is the matrix or this fertilizer that's utilized to help stimulate that regenerative process for your own body. So in essence, as I said before, it's the idea of we're refilling the gas tank. Your body's already done this; it's just kind of getting low on gas. So let's refill the gas tank and set your body in motion to do what it's always done, right? So you can see here in this image just some of the breakdown of what's in this matrix or this fertilizer, as I like to call it. So they're called growth factors and signaling and all kinds of different stuff that help the body regenerate and trigger this regenerative effect. So the process is relative to a lot of other treatments, specifically degenerative treatments. The treatment process is very, very, very mild. So you can kind of see here the post-operative care. The injection site might be a little sore. We do use a little numbing agent in the injection site. What I like to relate it to is if most people have had blood drawn in the past, if you've had blood drawn, the injection is significantly less impactful than that. So it's really, really, really very much on the non-invasive side. So most people that have come in and had the injection have said that was significantly easier than they ever thought it would be. So the injection process is very simple. And then basically for the first couple of weeks after the injection, you still want to not be taking aspirin and ibuprofen and Aleve and stuff like that. And you don't want to be doing any high impact activities. Now that's pretty uncommon anyway for joints that are degenerated. You're probably not doing a lot of high impact anyway, but you do want to just kind of take it easy because you want that matrix, that fertilizer to have the effect inside the joint and let your body, take on that regenerative process. So really be kind to that joint, be kind to those new cells as they're rebuilding. So saying no to amniotic fluid injections means potentially the reality is more drugs, right? Or more steroid injections or more surgery with more recovery drugs. So I think, having, again, done this for 25 years and talking with thousands of patients at this point is I think what I've come to realize is that most people really just don't want to take drugs, and they really just don't want to have surgery. If that's an option, that would be a better choice, is what I hear from most people. And that's why for me we started to look at how do we provide a foundation for people to regenerate and actually provide a natural means for people to move forward that gets them off of drugs, or maybe even starts the process. They don't have to go down that road, and and maybe puts people in a position where they don't have to have more surgery. So this for us made a really simple solution to make available for our practice members. So that's why our nurse practitioner, Janet, who's our medical director, is really great at helping people get clarity on, is this really the right thing for them, and helping with that clinical decision making and deciding, okay, yes, this is a person who's going to qualify. They're going to do great with the therapy. This is how we're going to apply it to increase the probability for the best results possible, and really keeping people off of drugs and preventing surgeries and really living a more involved or vital quality of life. So the most common areas that we're kind of working with are things like tennis elbow, and then so joint pain and arthritis. We've worked with ankles and Achilles tendons, shoulder pain and shoulder injuries, chronic trigger points and knee pain, knee degeneration. In fact, we just had a patient in 2 weeks ago now, that was told she had to have surgery, knee replacement, and she is almost 80% better a week later after her injection. So truly just awesome. So just know that, again, we're not talking degenerative therapies, we're talking regenerative therapies. So different situation, different results, different possibilities. So really exciting. So this is a therapy that is covered by Medicare as long as the person qualifies. So one of the common questions we get is what makes a person qualify? Well, there's lots of little ifs, ands, and buts. One of the major pieces is it's covered by Medicare Part B. So if you have Medicare Part B, it's likely to be covered. So that's one of the hurdles that we have to figure out. How we handle this is we do a kind of a pre-authorization or pre-qualification consultation examination, so that we get all the data and figure out exactly what's going on and how best to help you get the results that you're looking for, and what would be considered a good result. So we figure all that stuff out, gather all that data, and then submit it to Medicare for pre-authorization, and then communicate with you based on what we hear back from them. So we'll know exactly what to expect before we would do anything. So what now, right? So our program obviously is designed for the potential healing of soft tissue damage, which includes degeneration. It also includes chronic trigger points and stuff like that. And we're really focusing on primarily orthopedic type utilization. So neck type stuff, low back type stuff, shoulders and ankles and elbows and wrists and hands and knees, and all of those areas are areas that we've worked with patients with great results. So how to take advantage of, like, what do I do next? Well, it's really simple. So the first thing you have to do is go to our website. That website is lifealignedwellness.com. I put the link in the group chat, so it's listed right there. So you go to our website, lifealignedwellness.com, and then you're going to click on the Schedule Now button, which is on the top right-hand corner. Right? When you do that, you're going to be taken to a page that you'll select the type of appointment that you'd like. And there's 6 different types of appointment. You'll see there's neurostructural chiropractic, or the first 2. The next 2 are DNA-based weight loss, and the last 2 are stem cell consultations. And one is in person, and the other one is virtual, and you can do it either way. And so select either in person or virtual, and then you're going to be able to pick your time available. So once you select the type, you're going to be able to then pick whatever time you want to schedule your consultation at. And now here's the key. If you don't use the code webinar, you're going to have to pay for that appointment. All right. So you'll have to enter the code webinar to get the discount that's available today only. Normally, I think the fee is 99 or 49, one of the two. Sorry, I don't remember. But enter the code webinar into the code box, and that will take away the fee for the appointment, right? And then after you've scheduled that, Amber, who's our medical assistant here, who works with our medical director, she'll give you a call today to help walk you through really to determine if you qualify. So she'll be able to answer a few of the basic questions, ask and answer a few of the basic questions to really find out if this is like if we can kind of take the next step in moving forward to see if you're a great candidate. So, so really very simple. Again, just go to our website, lifelinewellness.com, hit the Schedule Now button, which is the top right corner. Pick the type of appointment you want, either in person or virtual. Enter the code webinar to get the discount code that's available today. And then Amber, our medical assistant, will literally give you a call later today and help walk you through and determine if you really if you qualify as far as condition and time frame and treatments and all that kind of stuff. Like I said, it's about a 10-minute phone call to kind of ask all the questions we need to know if we want to move forward and if you're going to be a good candidate for it. All right, so I'll leave that slide up for just another minute. I'm going to kind of open it up for questions. And before I do that, again, I just want to say thank you. Thank you for spending the time, taking action, and looking at regenerative medicine, right? I see so many times people just spiral. Things get worse and worse and worse and worse. And this is a way to turn things around. Actually, like I said before, turn the clock backwards. So thank you for taking the time and giving me and us this potential opportunity to help you really enhance your quality of life in a natural way that is not degenerative in nature. So again, thank you for that. All right, so I will go ahead and unmute everybody. So you can ask me questions directly just by speaking directly, or you can message me in the group chat if you'd like, and ask those questions through there, and happy to answer them. So I'll stick around here for a little bit, and you guys can answer any questions that you have.
Dr. Cox?
Yes.
Yes. Okay. This is Liz Lucavoli.
Hi, Liz.
Hi there. You have recommended this treatment for me.
Yes.
So what do I need to do as far as, since you already know that that would work for me?
Yeah.
I just need to talk to somebody to tell them my Medicare information?
Yes. So we still want to ask a few other questions and stuff like that. So definitely go ahead and schedule your appointment online. So just follow that, go to our website, enter the code and schedule your appointment. And then we'll get Amber's going to get a message that you scheduled that. And then she'll give you a call and kind of walk through all of those questions. Okay. And then make sure that we have the kind of the go ahead on the first kind of pre-authorization piece.
Right. Okay. Thank you.
Does that make sense?
Mm-hmm.
Cool. It was great to see you. Great to hear you and see your name in the lecture. So glad you popped in.
Oh yeah. Thanks.
Awesome. And Millie, great question. Yep, you're all set. And yep, you're already all taken care of. And yes, it can help with RA as well as OA. So no question about it. It's a perfect type of application. So when you meet with our medical director, Janet, she'll be able to kind of dot all those I's and cross all those T's and make sure that everything that is occurring in your health and your health history that really lines you up for a great result.
Okay, so I will get the discount?
Yes.
Yeah. Oh, okay. Okay.
Yeah.
I don't have to go back in or do anything like that. Okay. Thank you.
No, I'll still have Amber give you a phone call.
Sure.
And just go through the basics.
Okay.
Cool.
All right.
Great. All right. Any other questions?
Yes. Can you hear me?
I can.
It's Brian Gray.
Yes. Good to see you or hear you.
You said you were going to leave all the stuff up so I could copy it down, and I started through and then you took it off.
I'm sorry. Let me go back to that. There we go.
Thank you.
Absolutely. I did put it in the group chat, so it's in there as well. Good. So yep, just lifealignwellness.com, and then hit the schedule now button on the top right corner, and then you'll select either appointment type 5 or 6, whether you want to do it in person or virtual. Obviously, the virtual version, we can't actually do an exam, right? So we can at least do the consultation part and gather a lot of the preliminary data. At some point, obviously, we'll have to do an in-person examination, but we can accomplish most of those things. One of the things, if you have COVID concerns, we're able to do our Regen Center is actually in a separate. It's a separate office suite just across the hall from our main office. So we're able to create a lot less traffic in that particular environment as well. So we've taken the appropriate steps to make sure that people feel safe there too.
I have a second question.
Certainly.
And that is, when you had the charts up and you showed elbows and that sort of thing.
Uh-huh.
As you know, I'm having trouble with my left hip. Is that an area that this would apply to? It seems like it's a joint or something like that.
That's a great question. Yes, we have absolutely worked with people with hip degenerative change, and they have done fantastic as well. So yes, that's definitely an area that we worked with in the past.
Do you have some references for that?
I can't necessarily give you patient names, only because of privacy type stuff. So I would say the first step is, let's make sure that we kind of go through the examination process, and make sure we have current imaging and that kind of stuff, so we really know the situation we're dealing with, and then we can make the best recommendations and kind of go from there.
Thank you.
Absolutely. Good. Any other questions? Good questions today. Okay, that looks like it's about it then. So we'll just kind of wrap up and again say thank you so much for showing up today and taking an active role in your health and your health future. So for those of you coming in, I look forward to seeing you. I may not be around for your appointment because again, I'm on more the wellness center side. This is more the regenerative medicine side. So I'm sure you'll see our front desk person, Victoria, and you'll be meeting with our medical assistant, Amber, and you'll see Janet, our medical director, for this process. So have a great rest of the day, and we'll hopefully meet and talk with you guys soon. Have a great day.
Okay, thank you.
Thank you.
You bet. Bye-bye.